Most people with COVID-19 recover within a few weeks after infection. However, for some people, COVID-19 can cause symptoms or complications that last or appear beyond 3 months, even after testing negative for the virus. This is called long COVID, which is also known by other names such as post-COVID and chronic COVID. Long COVID can be debilitating as it involves a wide range of health complications that can last months or even years after infection. There are a wide range of symptoms found in patients with long COVID that can vary in progression and type of health condition experienced from person to person. Common symptoms include fatigue, respiratory and health symptoms which include shortness of breath, cough, and chest pain, neurological symptoms including cognitive difficulty, dizziness, anxiety or depression, and problems sleeping and muscle pain. Some symptoms of long COVID can be hard to diagnose and show normal results on routine chest x-rays and blood tests. This is why healthcare professionals usually suggest patients write down all the symptoms that they are experiencing and a list of medications the patient is taking prior to arriving at a healthcare provider appointment for long COVID. Patients can also develop new health conditions after recovering from COVID. Patients who experience severe COVID symptoms may also experience multi-organ effects, which can last weeks, months, or even years after COVID diagnosis. These effects can involve the heart, lungs, brain, skin, and the kidneys. This multi-organ effect can result in health conditions such as diabetes, heart conditions, or neurological conditions not commonly found in patients with COVID. Patients may also experience post-intensive care syndrome, which includes experiencing muscle weakness, cognitive difficulty with judgment, and similar symptoms to post-traumatic stress disorder.
The direct causes of long COVID are not currently known. So, researchers at the New York University Grossman School of Medicine and the Icahn School of Medicine at Mount Sinai looked at the effects of COVID-19 in animal models to understand potential causes of long COVID. The researchers used golden hamsters as models as their infection duration and symptoms are similar to those of humans. They infected the hamsters with SARS-CoV-2, the virus that causes COVID-19. They compared these models to golden hamster models infected with the flu virus, influenza A, which produces a similar immune response. The researchers also analyzed the brain tissue of people who recovered from COVID-19 and died later of other causes.
Like humans, the hamsters recovered from COVID-19 infections in about 2 weeks and developed similar symptoms. However, compared to the hamsters infected with influenza, the models infected with coronavirus had greater lung and kidney damage, which also healed more slowly. Interestingly, the researchers found prolonged inflammation in the olfactory bulb, a rounded massive tissue located on the bottom side of the brain, which relays smell signals to the brain and influences emotion and learning. The researchers found that the olfactory bulb remained inflamed in some hamster models infected with COVID-19 weeks after the infection was gone. Additionally, the chronic inflammation observed in the hamsters correlated to behavioral changes that reflect mood disorders associated with long COVID, such as anxiety and depression. The researchers also found similar inflammation in the olfactory bulb of people who recovered from COVID-19 and died of other causes. This prolonged inflammation indicates that the immune system remains activated even when the virus is no longer present. Furthermore, the persistent inflammation in brain tissue may be responsible for the mechanism causing long COVID symptoms in people. However, further research is needed to understand this mechanism.
Treatment options for long COVID are still evolving as researchers continue to understand the condition. The most effective approach to treating long COVID is to manage individual symptoms. For example, those experiencing fatigue may benefit from graded exercise therapy or pacing techniques, while those with shortness of breath may benefit from pulmonary rehabilitation. Other treatments for specific symptoms include cognitive behavioral therapy for mental health issues and anti-inflammatory medications for joint pain and headaches. In addition to symptom management, there are also ongoing clinical trials for specific treatments for long COVID. For example, some trials are investigating the use of monoclonal antibodies and convalescent plasma to reduce symptoms, while others are exploring the use of antiviral medications such as remdesivir. It is also important to note that prevention is key in reducing the risk of long COVID. This includes getting vaccinated against COVID-19, practicing good hygiene, and avoiding exposure to the virus. Vaccination has been shown to reduce the risk of severe illness, hospitalization, and death from COVID-19, and may also reduce the risk of developing long COVID. For individuals with long COVID, it is important to closely work with a healthcare provider to develop a personalized treatment plan that addresses individual symptoms and needs. This may involve a combination of medications, therapies, and lifestyle changes. In conclusion, while treatment options for long COVID are still evolving, there are a range of approaches available to manage individual symptoms. As researchers continue to investigate the condition, it is hoped that more effective treatments will be developed in the near future. In the meantime, prevention through vaccination and good hygiene practices remains the best way to reduce the risk of long COVID. For more information, please visit the links provided in the description from Health Canada.